Dr. Emmanuel Ame is a obstetrician gynecologist, and he's my guest as we talk family planning. We want you to be a part of the conversation. So just from the very beginning, you're welcome to send us your messages or give us a call so we can have this conversation together. Dr. Ame, good morning.
Good morning.
Thank you very much for your time. I think this conversation is timely for me because I was thinking I'm on IUD.
Okay.
And it's been, I think, 7 years. Okay. This was for 10 years. I was asking myself, do I have to wait for the 10 years to go and change it?
Okay. So first of all, I want to say congratulations to you for being on IUD, because you're one of the people ensuring that our future in Ghana is quite secured. For the IUD, you could be on it for, previously it was for 10 years. Mm-hmm. Now it can be there up to 12 years. Although we say it is for that number of years, you don't have to use it for that up to 12 years before it is removed. At any time you are ready to continue your reproductive life, you could go to any of the clinic and it will be removed for you in a short time.
Okay. Yeah. So now after I remove this, I can do 12 years?
No, so you can, the one that is there now can be left there for up to 12 years.
Oh, really?
Yes, please.
Hey, wait, yes. When I was doing it, they said 10 years.
Yes, please. But you see, one thing about science is that science is advances and we do a lot of research. We found out that the IUD, we said it could be there for 10 years, could be left there for up to 12 years.
Oh,
yes, please.
Okay. But can I still try other methods? I'm absolutely comfortable with this one. But can I try other methods?
Oh, yes, yes. The good thing is that in Ghana, we have a wide variety of method mix for family planning method in which you can use. And then at least we have up to 12 to 13 methods you can use in Ghana. Family planning is an individualized thing that you go there, you're giving some counseling, you look at the method that is appropriate for you. Once you make your choice, the health provider will assist you to ensure that the method you have chosen is okay with you. And once it's okay, you can choose any method at any time.
It's good that you're a man and you're talking to us about family planning, because one of the things I wanted to do this morning is not to make this conversation a women's conversation. Family planning is not just about women. But let me ask you, since you are the expert, how involved are men?
Okay, these days we're having a lot of men getting involved in the family planning practice. What is happening is that nowadays we see a lot of men who come with their wife to the healthcare facility to receive the family planning method. And it's been shown that when the men are involved in the choice of the family planning method, the continuation and the use of the method, either by the male or the female, tends to be longer. And then the benefit is not only for the family that's involved, but it's a benefit that goes beyond the individual. It goes to the society, it goes to the nation. So the more men are involved, which is increasing these days, the more people we see that use the family planning method and are able to retain it for the period they desire.
Okay. The natural family planning, is it still reliable? And explain to us, maybe we should go back to a bit of the beginning, the different types of family planning, including the natural method. Okay,
so there are quite a number of family planning methods, like I said earlier on. We have quite a number, so I just list them for simplicity. We have what we call the natural family planning method, which includes a woman understanding her reproductive cycle, and together with her partner, they agree to have unprotected sex at the time that it is safe, and then avoid unprotected sex at the time when it is not safe. That's what it means.
Yeah, but tell us what the safe period is.
Okay, so the safe period is it differs from one woman to another. And that is why when you're going to choose the natural family planning method, when you're going to choose the natural family planning method, you have to do this in conjunction with the health service provider. So they will help you identify it. So today, I'll give you an example. One of the things that has been done to make it easy for every woman, let's say, for example, a woman is going to use a calendar method. We now have what we call the circle bead. The circle bead is just a bead that makes it easy for a woman who fits the criteria to know that, okay, if the beads are on the color brown from these days, it means that I'm safe to, it is safe to have unprotected sex. Once the beads are on the white one, it is not safe to have, it's not safe to have an unprotected sex. That's one of them. You also have the women using their understanding of the secretions from the vagina, and using that you are able to know when it is safe and when it is not safe.
Oh, you can tell from...
Yes, the secretion.
Oh,
so
okay.
if you go to a clinic, you'll be taught how to do that. But like we said, for each one, there are certain criteria that must be met. And it is you together with the healthcare provider that can make that decision. But one of the things with the natural family planning method is that if you do not have a motivated partner, especially the men, you are not a candidate that should be using that, because it's likely going to fail. Okay. Now, we have other methods, but these are examples of the natural family plan. Then we have this, the contraceptive pills. We have 2 types of contraceptive pills. Then we also have the injectables. The injectables can be taken either 1 month at a 1 month interval or a 3 month interval. And currently, even with a 3 month interval, we have the one that if you use it for a while, you can give you some to take home yourself. You are taught how to self-inject yourself, and then you can inject yourself for the next 3 times you will need to do it. So you don't have to visit a health facility every day because you've been taught. Then we have what we call the implants. The implants are the ones we put in the arm. You have the one that you can use for 3 years, you can use for 5 years. Then we have the IUD, like yourself is using. It's also very effective. It can be used up to 12 years. We have another form of IUD that can be used for 5 years. That one contains a little bit of hormone. Then we have the barrier methods like the condom. We have the male condom, we have the female condom, which can be used. The advantage of the male and female condom is that apart from preventing pregnancy, they also prevent sexually transmitted infections. That is one advantage that it has. Then we have the patch and the rings. We don't have that in Ghana, but they are also available. Then we have the permanent methods. We have what we call the male sterilization, or also called vasectomy. And then we have the female sterilization, also called tubal ligation in very simple languages. And then we have other methods that can be used. There are quite a number of them we can use.
Is this, because one of the things we usually do not have is data. Is there enough data, strong data to determine the number of Ghanaians, for instance, who are on any of the family planning methods or who are doing family planning?
Okay. When it comes to data, I must say that the Ghana Service is doing a lot of work.
Okay.
And we have clear data. Because once you go to any healthcare facility to get a family planning method, or you visit any of the shops, the pharmacy shops, because we have pharmacists now, we have trained, they can provide off-the-counter kind of family planning method. Those data come back to us, so we have a good data.
Okay.
Except you go source from it, probably from somewhere that is not, that's where we don't have. But we can say confidently that in Ghana, based on our last survey we did, that when it comes to married women, 25% of women are using family planning method. However, 31% of women who should be on a family planning method are not using.
I'll come back and ask you who should be on a family planning method. But let's go to the phone lines because I've asked our viewers to also join us. Abdul is in Nalirugu. Good morning, Abdul. Hello, Abdul. I'm afraid I think I lost you there. Do I have Mariam? Mariam in Kumasi. Hello, Mariam. Okay, we've lost you both. Apologies. Kindly give us a call back on the numbers on the screen. Who should be using family planning?
Every woman that is sexually active and within the reproductive age should be using family planning method. One thing we need to understand is, apart from preventing pregnancies, family planning methods have non-contraceptive benefits that the woman can benefit from. I'll give you an example. A woman who is using the oral contraceptive pill, apart from preventing pregnancy, actually has other contraceptive benefits she can get. A lot of women we know today have issues with menses. For example, when they are menstruating, they have severe pain. It's been shown that women who are on the oral contraceptive pill can actually benefit from reducing the pain they get. Women who, for example, when they are menstruating, their menstrual cycle is irregular, with the use of oral contraceptive, with the advice of a doctor, it can make the cycle regular. Women, it's also been shown that women who are on oral contraceptive pill, the risk of developing ovarian cancer is reduced tremendously, depending on the number of years they've used it.
Okay.
So for a woman who is on oral contraceptive pill, who has used it up to 10 years, her risk of developing ovarian cancer is reduced by 70%.
Just pause there. We'll come back and continue, but let's go to the phone lines. William is in Kaswa. Good morning, William.
Good morning, Mavi. How are you doing?
Oh, very well, thank you. Thanks for asking. Let's hear your thoughts. Is it a question?
It's about the natural method.
Okay, sure.
I and my wife have been doing it. We've been planning it for about 2-3 years.
Okay.
But I can say it has failed out about 2 times.
As in, it has failed about 2 times.
After every birth, the cycle changes, so my life cycle changes.
Okay.
And it's always a problem for us. So I just want to ask about if there is any other method that we can use above the natural one.
Okay.
Because we like the natural one, but about 2-3 times it has failed us. And when I want a method that will at least give about 5 years before I can give it again.
Okay. All right, William. The doctor will answer your question. Let's talk to Sarah. Sarah's in Obuasi. Thank you to William. Sarah's in Obuasi. Good morning, Sarah.
Good morning, Mama V.
Yes, Sarah. I hope you're doing well.
Yeah, mine is actually a question.
Okay, sure. Let's hear it.
But not family planning, to be precise.
Okay.
Mama V, I want you to ask the doctor for me. I have my menses on the 11th of September.
Hello, Sarah. Oh, I'm afraid we lost you. Kindly call us back. I know you said it's not family planning related, but my guest is a gynecologist, so that question is still welcome.
Yeah, I think it's related.
Okay, all right. Let's talk to Jude. Jude is in Abeka. Good morning, Jude.
Morning.
Yes, Jude. Thanks for calling. Let's hear you.
Please, I wanted to ask whether men too, they have their own.
Okay. Yes, they do. Is there a follow-up question? Doc will explain it.
Okay.
Okay, so you just keep watching and listening. The doctor will explain all that. Amankwa is in Kumasi. Good morning, Amankwa.
Yeah.
Yes, Amankwa.
Yeah, with the issue of family planning, I've been advising my wife to practice any of them.
Okay.
But she is reluctant because her elder sister practiced one of them and she was having complications with her. So she is afraid to practice it. So any advice, or do we have any negative effect when we decide to take any of the family planning?
Okay, that's a very good question. We'll come to that, Amankwa. Thank you very much for calling and sharing. Ibrahim is in Wa. Good morning, Ibrahim.
Good morning.
Yes, Ibrahim, you're on air. Let's hear you.
Okay, Peter, I wanted to ask you, when can a lady or pregnancy do after the period? You normally take 3 periods after menstruation, so I don't know the number of days.
Ibrahim, I'm afraid you have to ask the question again, okay?
Okay.
Hello, Ibrahim?
Yes.
Please ask the question again. We didn't quite hear you.
I said, how many days can a lady be after a period that with her pregnancy?
Did you get the question, Doc? Okay, we were having that interference. Ibrahim, I'm afraid, can you come again just for the very last time? Is the question, how soon does the menses return after pregnancy or giving birth?
Not really. It has been that a lady can have a sex with an unprotected distance as in constant after pregnancy after some days of a period, menstrual cycle.
Oh, how many days can it be safe, you mean?
Yes.
Okay,
yes.
All right, sure. I guess it's the natural method that he's asking, Ibrahim. Okay, thanks a lot. Let's talk to Joseph in Takrady, and then we'll hold on with the calls, address the issues that have come back, and then have come up, and then we'll go back to the phone line. So Joseph is my last call, at least for this segment. Joseph, good morning.
Good morning, madam.
Yes, sir. You're on air. Let's hear you.
Please, my wife had a miscarriage a week after our wedding, and went to the hospital to remove the rest of the clot. But after 1 year now, she has not been able to conceive again. I want to ask the doctor if there's a problem or what might be the cause of that.
Okay. Joseph, that's a very painful experience that you went through. We thank you for sharing, really, that very personal experience with us. Joseph in Takrady, thanks for calling. We'll address your issues. Doc, let's go back to William in Kaswa was asking about the natural method. Am I correct?
Yes.
Okay.
So let me start that one of the reasons we have problem with the natural method is that a lot of times people don't, when it comes to the natural method, very few people actually go to see a health service provider to teach them how to use it. And like I said, if you go to see a health service provider, you don't just take the method. They will assess both of you and your partner to see if you fit. Remember I said that for natural method, if both couples are not motivated, they are not candidate. You know, sex is something that a lot of time, once it wants to happen, it happens. And if you're not well motivated, and maybe the day you are going to have sex, that is the day that it is unsafe. If you don't use a barrier method at that time, then it means that it's likely going to fail. The other thing is that people have a very wrong notion. There's this thing among people saying, oh, for this thing, I know this is my ovulation, the period, 2 days before, 2 days after, I don't have sex. I'm sorry to say, it will fail a lot of people. Because the sperm can last a longer period of time, even after it has been deposited, and it can still get a woman pregnant.
Okay.
So the sperm can last up to 5 days, and sometimes, in some cases, up to 7 days. So if a woman has sex 7 days ago, and you are doing your 2 days before and 2 days after, obviously pregnancy will come. That is why we say that irrespective of whatever method you want to do, go to a family planning clinic. You'll be taught properly. You will be assessed to see whether it's fine. So what our advice for William is, please get to a family planning clinic. There are quite a number of methods that can be used by you. They are very, very effective. The effectiveness is very, very high, so that you can prevent pregnancy. He says he wants to prevent pregnancy for the next 5 years. Then together with your wife, you can use a method, have a lovely time together for the next 5 years, and when you are ready, you can have...
There's a related question, which I think has to do with the myths and other people's experiences. And so others, after hearing those experiences, they tend to be afraid. What can you say with the question related to a sister who had used a method and was having an unpleasant experience, and so the wife is afraid to also go in and do family planning?
Okay. So let me say this. One thing we need to understand is that even for twins, a method that is okay for me may not be okay for another person. No, the second thing is that at the counseling, at the family planning clinic, there are some things a woman may observe that normally will be worrisome. But when you are counseled properly, you are told about it such that you don't worry. And even if you see it, usually you could come back to the clinic, you're giving some 1 or 2 things and it will go away. I'll give you an example. Some women will tell you that when they start, for example, IUD, some women will tell you that the first 3 months they notice that they have cramps or their menses is heavy.
I had heavy menses.
But once you go back to the clinic, you're giving the medication for just 5 days, it stops. And usually, like you could notice that after the first 3 months, most of those side effects that you notice they disappear.
I didn't go back to the clinic because the nurse informed me of what was going to likely happen. So I knew about it. And then she promised me that it was going to become normal after a certain period. So I just relaxed.
And that is counseling we're talking about. Because counseling is supposed to inform you what you should expect and what you need to do to handle it. I'm sure that even with the counseling you had, if it was persistent, you would have gone back there.
Absolutely.
Now, the other thing I need to say is that because there's a wide method mix, if you use a method and you are not too happy with it, then you could go, either it is addressed or you could change to another method. Now, in this case, for the gentleman who was saying this, I think that you should remember that the man also, because he's also motivated, is an motivated individual.
So it's not just a woman's thing.
Yes, the man too can use methods depending on what they have. The condom is there, okay? The natural family planning method is there. Then we also have the permanent method if they have completed their family size.
You know what the men say? The condom is not the same. The feel is not the same.
Oh, I know what you're talking about. You want to eat the toffee without the rubber. Now, but the truth is that we have condoms that can be used, and today it will look as if there's absolutely nothing there. Okay? Yet it will provide the protection that the person so desire to have. So there are many things out there. There are innovations that are taking place that can actually improve the use of the family planning.
Who is the appropriate person? I know for a woman, you speak to a gynae first,
yes,
and then you can talk to, is it the matron? They've got special nurses in charge of the family planning. But for a man, who do you talk to?
Oh, yes. So let me say this, that for the men, all of these people you've mentioned can be spoken to. So you can come to see the gynecologist, okay? Come along with your wife, and this is what you want to. Or you can even visit any healthcare provider. I must say that apart from the gynecologist and the family planning nurses, there are a lot of healthcare providers who can at least give you the first briefing before you visit the family planning clinic. And there are quite a number of family planning clinics that are distributed nationwide. There are a lot of family planning providers. We've extended our services beyond the hospitals. You can have, that's why I'm saying that you can go to some pharmacy shop now. They could give you the necessary advice. And even if the method you want is not available there, they will direct you to the appropriate place where you can get the service you so need.
But you know that we've heard very horrible stories associated with family planning. Some very scary stories that people share about themselves.
Yes, so I want to say a lot of it are actually myths and misconception. Unfortunately, they say, let me use this proverb to explain what I mean. Once a child dies in the neighborhood, the old woman who lives in the corner is always guilty. And the truth is that family planning is actually one of the things that help us as a country. If you look at a lot of countries where a lot of development is taking place, I can assure you that their family planning uptake is very high. And so those individual things, yes, few people may observe, but some of them are not true. There are some of them that came up even recently that has been disproved that they're actually not true at all. So, but what I would say is that if you have any problem using a family planning method, get back to the family planning provider, and then it will be taken care of.
Okay. Did I miss any of the questioning? I think Joseph's question had to do with the wife's miscarriage.
Yes.
And then after a year.
Yes. And she's not been able to
conceive.
First of all, I must say that was an unpleasant experience, and I understand with that, and I wish them a better reproductive life together. But let me say this, is that if she's unable to conceive, the best thing to do is to go to a clinic, see a gynecologist who assess both the husband and the wife to see where there's a problem, if any at all. But sometimes they may actually not be a problem. It's just a matter of proper education, knowing when to have sex. One thing people should understand about family planning does not just prevent pregnancy. Family planning helps the couple to plan to have the number of children when they want to have it, the number they want to have it, and at the right time when they want to have it.
Okay. I'm just thinking that for somebody who once got pregnant,
yes,
it's almost impossible to think that there was a problem or one person had a problem. Okay. But if you're trying to conceive, how often should you do it?
Well, if you want to conceive, what we will say is this. First of all, sex is not only about conceiving. It is both for pleasure, it's both for intimacy, and then childbearing. And so what we advise is that couples should have sex as much time as they can. The truth is that if you begin to see sex just to conceive, then there's a tendency that anxiety begins to set in. And once anxiety begins to set in, that in itself is not a very good thing you should have if you desire to have children. So we advise that couples should have sex as many times as possible, 3 or more times in a week. okay? And when I mean 3 or more times, I'm not talking about 3 times in a day, but I'm talking about 3 more days in a week, okay? And with that, you are sure that because of that, you know, the fertile period in a woman's cycle is just some few days. The ovum can only last about 2 days, but the sperm can last about 5 days. So the fertile period is not a very big window. And a lot of times, sometimes when people say they are unable to conceive, it's because they are having sex outside the period or not within the period in which, if the sperm was deposited there, they can achieve pregnancy. And that's why when you go, we'll look at your cycle, we observe, we do investigations, and then we're able to identify. Sometimes they are not absolutely no problem. It's just wrong practice, wrong timing, and then you advise, and then you can.
Okay. Did I miss any of the questions? I saw you noting a few things down. If I missed any of the questions.
The man from WA was asking a question about what time is it that you can have, it's safe. Yes. So like I said earlier on, that the safe period varies from one woman to another. It is not, they believe to say that it's day 14. There's this belief that every woman ovulates on day 14 of their cycle.
That's not true.
Oh. It's absolutely not true. Okay? But we can anticipate within which period you should have. That is why when you go there, they look at your menstrual cycle, and then they'll say, okay, for you, we think that from so and so days to so and so days is this. And then on the basis of that, you are given or shown the way you can use the natural family planning. Actually, the natural family planning method has been simplified. And that's why I was talking about the cycle bead. It's simplified. Even if you can't use the cycle bead, there's a way you are taught how to use your calendar method. There's a way you can taught how to use the cervical mucus to determine when it is appropriate for you to. So it can be determined, but you must go to a trained healthcare provider to give you that counsel.
This is not 100% though. There's a possibility that this could fail and you still could get pregnant. You can be on IUD and get pregnant.
Absolutely. No family planning method is 100% effective because it's man-made. But we know that, for example, if you are using IUD, if 100 women should use IUD today, less than 0.01% of them will get pregnant.
Oh, okay. I'm very confident with that.
Yes. And that is why up till now, it's not failed you.
No, it hasn't. But you know, sometimes when you read other people's experiences, see, sometimes you read what other people say, and then you are mindful of what you're on, and you say, this could fail.
Well, the truth is that people like you who are using it and who are having a good experience, we need to hear more of you. Because that is actually what is happening. When we talk about method failure, it's not that they can't fail. Yes, they can fail, but the failure rate is very low. And that is why if you go to the family planning clinic, I'm sure the day you went there and you saw the number of people who were coming there, you're like, whoa. So this number of people are actually using it. Yes, there's quite a large population using.
But you say 25% of married women in Ghana are using it.
Yes.
And those who are supposed to, you explained to say those who are sexually active.
Yes.
2 things. You were talking about what the benefits that you could derive from, apart from spacing out and also preventing, if you're using the condom, sexually transmitted diseases. How early can I introduce my child to family planning? There's the issue, and anytime this comes up, there's the issue of, am I not rather saying to the child that you can go ahead and have sex, just don't get pregnant?
Okay, like I said earlier on, that family planning helps to achieve pregnancy at the right time and to prevent pregnancy. Currently in Ghana, 61% of adolescents who are sexually active are not using a family planning method.
61%?
Yes. So that's quite a large number. Now, one of the things we need to know is that knowledge empowers people. Knowledge does not necessarily make people to do things wrong. I'll give you an example. You know about electricity, you know which is red, which is neutral, which is live. That does not necessarily mean that you're going to be playing with electricity. But when you come in contact with electricity, you know which wire not to touch so that you don't get burnt or suffer an electrocution. the knowledge and education of people on family planning is been shown that, especially with adolescents, when they are empowered and given that knowledge, that does not necessarily mean that they become sexually active. Our work in Ghana has shown that the number of adolescents today who get pregnant or who end up stopping school is reducing because they are becoming more educated, they are becoming more knowledgeable, they know what to do to prevent, they know now that they can actually abstain from sex, they are much more focused. So the truth is that giving them that knowledge does not mean they're going to be sexually active.
Okay. So at what age? Is there an age?
What I would say is that when it comes to sexuality education, the earlier you start to teach your parents, the better. They vary. What information you provide for them are age specific. And so as early as possible, you should start. For example, in my house, I've had a conversation with my kids. And I remember one of those days, my daughter came to me and said, "Daddy, what is condom? What is it used for?" At that time, she was about, I think, 8.
Okay.
I think 8.
So should you wait for them to be curious and ask the question and then?
No, you should start that conversation. Actually, and the research that has been done, I did a research also, is that most children have shown that they prefer their parents to be the first person to have that education with them. The education does not necessarily mean you're going to tell them, "Hey, do this." No, don't. But you make them to understand. Because one thing with adolescents is that as they begin to age, their pair begin to become an important person in their life that plays an important role. And if you as a parent don't give them the right information, they would obviously get that information from their peers. And sometimes it may be wrong. I know parents sometimes find it difficult to do this, but with training, we can get parents to know how to have this discussion with them. And then they can obviously do the right thing at the right time.
Okay, we have to go, but I did stop you at some point, so I want to give you the opportunity to continue when you're talking about the benefits.
Yeah, now, so like I was saying, that it can prevent ovarian cancer, it reduces the risk of ovarian cancer, it reduces the risk of endometrial cancer. These are cancers that affect women. Now, it's also been shown that some conditions like what we call polycystic ovarian syndrome, which means like this, the ovaries are ballooning up and also affecting the woman's cycle, can be used for it. It can also be used in the management of a condition called endometriosis. Now, it's also been shown to reduce the risk of colorectal cancer in women. A lot of the women who use this contraceptive method also have a reduced risk of having some certain kinds of what I'll call non-malignant, non-cancerous breast condition that may affect women. Okay. So there are quite a number of benefits they have. Even for people who are sicklers using certain family planning method, it reduces their risk of getting crisis. Women who continue to bleed or have a heavy bleeding, we can use it to reduce their bleeding and then reduce the risk of having anemia. So there are quite a number of benefits. You're not just preventing pregnancy. They prevent pregnancy, or prevent pregnancy. Some prevent a sexually transmitted infection. Then in addition to this large number of conditions that they can address. So, but I will not say just because I've said this about this, you just go and use it for that. No, you have to see a healthcare provider. Together with in consultation with the healthcare provider, then the decision is made.
Okay. I wish I had more time to continue with the phone lines, because I know lots of people would have loved to continue with, asked us questions. Unfortunately, though, we have to end the conversation here. But you've given a lot of education, opened our eyes and our ears to this information. So I hope that we will learn from it. Thank you very much, Dr.
So for this week, for our family planning week, we're having a lot of activities. There'll be a lot of education taking place. Family planning services will be provided.
Free consultancy.
And one thing is, the family planning service is absolutely almost negligible, little to nothing. Most of them are actually free. And then there'll be a lot of service that will be provided. Condoms will be distributed around the country. We'll have a lot of open discussion with people in community. So please, let's make ourselves, once you see the family planning team in your area, feel free to go and see them and ask the necessary question.
Okay.
But one thing is, family planning is needed for the growth of Ghana. Thank you very much.
Thank you very much, Doc. And I must say that I don't know if the nurses are special, because they have a lot of time and patience, the family planning units.
Yes.
They are exceptional people there.
Yes.
So yeah, it's good to pass through. Thank you very much.
It's good to hear that. Thank you very much.
All right, that's our family planning conversation. We'll talk about the National Science and Maths Quiz next here on our show. The balloting for the 1/8 stage is done. Maxwell has a report right after this.